Everyone can see this, right?
Yes.
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 Good. Okay.
Yeah.
Again, if you have any questions while I'm talking, stop me. If not, we'll talk about it after the lecture. Okay? So, this lecture is on orientation, but also there's a lot of new words you have to understand. And I'm going to go through the important words that you should know. So, one important thing is how we talk about the human body. We always talk about the human body in the anatomical position. And the anatomical position of the body is when you're standing up, your feet are slightly apart, your palms are facing forward, and your thumbs are pointing away from the body. So you're standing up, your feet are slightly apart, and your palms are facing forward so that your thumbs are pointing away from the body. That is extremely important to understand. When a doctor, a nurse, a paramedic talk about these things, we're talking about the anatomical position. So that's why this is important. This is important. When you talk about right and left, you're talking about the body being viewed, not your body. Okay? So if you look at someone, you're talking about their right side or their left side, not your right side or left side. So here's some words that you really should know because you're going to see it on an exam, but you also should know it. Superior. Superior is the same as cranial. It means towards the head. The word cranial means head. So the head is superior to the abdomen. Inferior, otherwise known as caudal. We don't usually use that word caudal anymore because the word caudal means tail, and not many of you have a tail. Okay? So the word inferior is the word that we use. The navel is inferior to the chin. The word anterior or ventral means towards the front of the body. Your breastbone is anterior to your spine. Posterior, which is the opposite and also used as dorsal, means it's towards the back. The heart is posterior to your breastbone. So those are 4 words you certainly should know. Inferior, superior, anterior, dorsal, or posterior, cranial, ventral, and dorsal. Know those words. Medial and lateral. Don't worry about the word intermediate. That's not important. Medial. Medial means towards the midline. The heart is medial to the arm. It's closer to the midline than is the arm. Lateral. Lateral means away from the body. The arms are lateral to the chest. I'm not going to ask you any questions on intermediate. We don't use that term anymore in medicine. Proximal. Proximal, closer to the origin of the body. The elbow is proximal to the wrist, and the reverse is distal. The wrist is distal to the elbow. Distal means the farther out from the origin. So proximal and distal are very, very important, as also is superficial and deep. Superficial means it's external. The skin is superficial to the muscles. Deep or internal. It means it's away from the body surface. It's more internal. The lungs are deep or internal to the skin. There are major regions in the body, and there are two of them. The body is divided into two major divisions, axial and appendicular. Axial means head, neck, and trunk. Appendicular means your limbs, your upper limbs and your lower limbs, otherwise known as legs and arms. And these regional terms designate specific areas within these body divisions. Here's where we get into a lot of words. Okay? Cephalic. Cephalic means head. So this is your cephalic region right here. Here it is. And it consists of frontal, here's frontal, this is the frontal bone, orbital, obviously around your orbit, nasal, meaning nose. Here's a word you may not have heard before, buccal, which means cheek, Oral, obviously, is in your mouth cavity. And another word you may not have ever heard of before is mental. And mental means chin. Mental means chin. You know cervical, it means neck. You know thoracic, it means thorax. But the thorax is also divided into sternal, which is your breastbone, axillary, which is underneath your arm, and mammary, which is where your breasts are. Going down to abdominal. Abdominal, we'll talk much more about the abdominal region, but the middle of the abdominal region is your umbilical area where your navel is. That's the umbilicus, or your umbilical area. And then we get to the pelvic area, which is right below the abdominal area. And the inguinal area is known as your groin. And obviously, the pubic area is where your genitals are, both male and female. Okay? Any questions on that? All right. That is basically your axis. That's your axis. Now let's go to the appendicular area, which starts in the upper limb. The upper limb. Okay? The shoulder area is known as the acromial area. The upper arm is known as the brachial area. The place where you get blood drawn is known as the antecubital area. Antecubital area. Okay? The antebrachial area is your forearm. Ante means before. Before your upper arm is known as the forearm. Your wrist is the carpal area. The hand is known as the manus. It is divided into metacarpals. That's where your knuckles are. The palm or palmar area. The pollex, which is the only finger that has a name. The pollex is your thumb. And all the other fingers are called digits. The lower limb. The coxal area is your hip. The femoral area is your thigh. The patellar is your kneecap. We'll talk about the popliteal area when we get to the back of the man. The crural area is called the leg. The sural area is called the calf. And the lower area below your calf is called the fibula. It's the lateral side of your lower leg, the fibula. Pedal, which means foot, is divided into tarsus, which is your ankle, metatarsal, which is the bones of your lower foot, and you have digits, and you also have a plantar surface. This is the same as palm in the foot. It's called the plantar area, and the only digit that has a name in your foot is the big toe, and that's called the hallux. That's called the hallux. That is the anterior or ventral view of a man's body. Those words you certainly have to know. I'm going to probably ask you 5 or 6 questions on just those words. All right? The posterior or dorsal view, okay? The only difference in here is that you see now the olecranon. The olecranon is the back of the elbow, all right? Remember, the front of the elbow is the antecubital area, and the back of the elbow is the olecranon. That's the only thing that's changed in the upper limb. The hand is the same. There's no difference in the hand. The lower limb is the same. There's no difference in the lower limb. However, in the foot, you now have the calcaneal area. The calcaneal area is the heel. Another name for the heel is the calcaneus. Now in the cephalic area, in the posterior part, you see now the otic area, which is your ear, and the occipital area, which is the back of the head. Cervical area is the same. Now that you're in the back of the person, you now have the shoulder blade, which is the scapular. You also have the spine, which is known as the vertebral area. The spine is divided into the vertebral area, the lumbar area, and the sacral area. And what you're sitting on right now is your gluteal area. And the other thing in your dorsal view is the perineal area. The perineal area is the area between your anus and your external genitalia. So that is the regional terms that you all should know. Any questions on that? Okay. There are planes that we look at when we cut something up, actually. And there are surfaces which body or structures may be cut for anatomical study. And there are 3 common planes, and these are the planes I want you to know: sagittal, frontal, and horizontal or transverse. We will talk about them, and I'm going to definitely ask you questions on the exam on the planes. Sections, don't worry about. That's not important. We're not going to be cutting anything up, I hope. Sagittal plane. The sagittal plane divides the body vertically into right and left parts. Here's a way to remember the word sagittal. Go into the word. Go between the 2 T's. Take this part and go to the left. Take this part and go to the right. You have now divided that word into right and left parts. So when we say the word sagittal, it's now right and left parts. Don't worry about these other words. We don't use these words. We use this word, the sagittal plane. Frontal, otherwise known as coronal. By the way, coronal means crown. You know, you're talking about COVID, and COVID is a coronavirus because it looks like a crown. You've seen pictures of the coronavirus, and there are crown-like appendages to that virus. So frontal or coronal plane. This plane divides the body into front and back. So you have an anterior section and a posterior section. It's cutting the body from the head on down, front and back. It produces a frontal plane. Transverse, otherwise known as horizontal. You're now cutting the body horizontally. And you're now cutting the body basically around the navel. So you have a superior and an inferior section. You have a top and a bottom. It produces a cross section of your body. So don't worry about oblique. You need to know the three important planes: sagittal, frontal, and transverse. Okay? Here is the frontal plane. You cut the body into anterior and posterior sections. Here is the sagittal plane. You cut the body into left and right parts. Here is the transverse plane. You cut the body into upper and lower, superior and inferior parts. Those are your planes. And it just shows you again. All right? These are the planes I want you to know. Those three planes. Now, there are many body cavities in your body, but basically they're divided into two sets. And those sets of cavities are known as the dorsal body cavity and the ventral body cavity. Remember, dorsal means posterior. Ventral means anterior. So there's a back and a front. The dorsal body cavity. The dorsal body cavity has one function. It protects your entire nervous system. It protects your brain. The part of the dorsal cavity that protects your brain is known as the cranial cavity because that's where the brain lives. The brain is in your head, and that means cranial. The vertebral cavity, a subdivision of the dorsal body cavity, is in your back, and that's where your spinal cord is. So the dorsal body cavity encloses the nervous system. The cranial cavity encloses the brain. The vertebral cavity encases the spinal cord. Here it is. Here's the dorsal body cavity. Remember, it's in the back. It's in the back. Posterior. Contains the brain. Cranial cavity. Contains the spinal cord. Vertebral cavity. Okay? The ventral body cavity. The ventral body cavity is the anterior body cavity. It houses all of your internal organs. And when we use the word internal organs in medicine, we use the word viscera. Viscera. All viscera are organs. And we'll talk much more about that as we go on. There are also two subdivisions of the ventral body cavity: the thoracic cavity and the abdominal pelvic cavity. Both of these cavities are separated by the diaphragm. Oh, I'm going to ask you that question right there. What separates the thoracic cavity from the abdominal pelvic cavity? And the answer is diaphragm. The thoracic cavity. The thoracic cavity obviously is your thorax, your chest, and in your chest, there are other cavities. There are two pleural cavities. Those cavities surround each lung. So the cavity that the lung sits in is known as the pleural cavity. The cavity that contains the heart is known as the pericardial cavity. Peri means around, cardial means heart. This pericardial cavity is in your mediastinum, that is the center of your chest, the mediastinum. It contains the pericardial cavity. This cavity surrounds all of the thoracic organs, such as the esophagus, the trachea, etc. Okay? So there's also a pericardial cavity that encloses the heart. So in the ventral body cavity, in the thoracic cavity, there are a pleural cavity, there's two of them. There's a pericardial cavity also. So the pericardial cavity encloses the heart, but the mediastinum surrounds the other organs of the thoracic cavity. We now go past the diaphragm and into the abdominal pelvic cavity. The abdominal pelvic cavity has two cavities. It is the abdominal cavity, which contains your stomach, your intestines, your spleen, and liver, and other organs, and the pelvic cavity, which contains the urinary bladder, the ovaries, and the rectum, and also the testes. Okay, here it is, pelvic cavity. All right, very, very important. Why are these cavities important? Well, these cavities are important because when you have disease or a disorder, things become a problem. If part of your stomach protrudes into your diaphragm and goes into your thoracic cavity, that's a problem. And that is called the hiatal hernia. The stomach pushes through a hole in the diaphragm and ends up in your thoracic cavity. Your stomach should be in your abdominal cavity, not in your thoracic cavity. And what's the problem? Well, the problem is that stomach acid now goes into your esophagus, causing heartburn, ulcers, and in severe cases, we need to take that hernia and pull it back into your abdominal cavity and close the hole in your diaphragm. Membranes. There are many membranes in your body, but the majority of them are serosa. Serosa means serous membrane. It is a thin, doubled layered membrane that covers the surfaces of everything in every body cavity, including the ventral body cavity. It's two layers. There's a parietal layer and a visceral layer. This is very important because you're going to see this throughout Bio 110 and Bio 114. The word parietal means that it lines the cavity walls. So the parietal part of the serosa lines the internal cavity walls. The visceral part of the serosa lines the organs. Remember, I told you the word viscera means organs. So whenever you see the word visceral serosa, it's covering the liver, it's covering the heart, it's covering the pancreas, because those are all organs. Whereas the parietal pleura covers the cavity walls, not the organs. Parietal and visceral. I'm going to ask you a question on one or both of these. It is a double layer membrane. In between the two layers is fluid. It's called serous fluid. It's secreted by both layers of the membrane to reduce friction. That's the reason you have fluid in between the two layers of this serosa membrane. There are many names for cavities. We kind of talked about them already. The pericardium is the heart. The pleura, which is plural, is for both lungs. Here's another membrane, the peritoneum. The peritoneum is the serosal membrane that covers the abdominal pelvic cavity. Okay? So the pericardial membrane covers the heart, the pleural membrane covers the lungs, and the peritoneal membrane covers the entire abdominal pelvic cavity. All right? Why is that important? Well, it's important because if the membranes are inflamed, when they are inflamed, you lose the fluid in between the membranes. You now have caused friction. And when you have friction in a membrane that's covering the heart, every time the heart pumps, you get pain. Every time you move, you get pain. If you have loss of fluid in the pleural membrane, every time you breathe, you get pain because the lungs are now touching the walls of the cavity instead of the membrane being a cushion with the fluid inside. If you have an inflammation of your abdominal peritoneum, you have what is called peritonitis. The most common cause of peritonitis is appendicitis. When your appendix ruptures, you get peritonitis because now you have an inflamed peritoneal membrane, and it's pretty severe pain. Okay, let's talk about the quadrants. These are the four quadrants that are the divisions in the abdominal pelvic region. I want you to know these four quadrants: the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. I'm going to show you a picture because I want you to know what organs are in these quadrants. Here they are. The right upper quadrant. The right upper quadrant is the liver and the gallbladder. The right lower quadrant is your small intestine and your appendix. So when you get right lower quadrant pain, it's your appendix probably that's giving you the problem. In the left upper quadrant is your stomach and your pancreas and your spleen. So that's important. Those are the organs in the left upper quadrant. In the left lower quadrant, basically, it's your colon. Okay? So again, right upper quadrant, liver, gallbladder. Right lower quadrant, small intestine, appendix, which is part of your large intestine. Left upper quadrant, stomach, pancreas, and spleen. Left lower quadrant, colon. All right? So that's important. Now, why is that important? Well, let me just tell you why that's important. This is a true story. I'm working in the emergency department on a Saturday morning, and a young lady is brought in by ambulance. And here's her story. She has abdominal pain. Okay? She has abdominal pain. She's a basketball player. She's 17 years old from Philadelphia. They're playing in a tournament in New Jersey. And she was playing in a basketball tournament. and someone threw her the ball. She did not realize that the ball was being thrown to her. So she turned, and the ball hit her in the left upper quadrant of her abdomen. It was very painful. She went down to the floor, and she got up and she continued to play. About 5 minutes later, she collapsed. They called the ambulance. She was brought to me in the emergency department. I looked at her, and she told me the story. And I said to her, "Have you been sick in the last few days?" And she said, "Yes, I have." And I said, "Well, what's the problem?" She said, "Well, I've had a sore throat." And my mother called the doctor, and the doctor, without seeing me, said, "Oh, you have strep throat. I'm going to order antibiotics." So my mother picked up the antibiotics on Friday, which was yesterday, and I've been taking antibiotics since, but I'm not feeling any better. I looked in her throat and I realized she didn't have strep throat. She had mononucleosis. I looked in her throat and said, "Oh my God, she has mononucleosis." And in the disease of mononucleosis, your spleen enlarges. And this is where her spleen is, in the left upper quadrant. I did some quick blood tests to verify she had mononucleosis. And I called the surgeon and I said, "Get your butt down here. I've got a girl with a ruptured spleen." And he said to me, "Well, go ahead and get the CAT scan and I'll be right there." And I said, "We don't have time for a CAT scan. Get your ass down here now and take her to the operating room." All right? Now, the story gets a little worse. She's 17 years old. She can't sign for surgery. So I had to call her parents. So I called her parents in Philadelphia and I told them the story. And her father said to me, "Send her to CHOP." I went, "You're crazy. If I sent her to CHOP, she could die." He said to me, "I'm a lawyer. If she dies on that operating room table, I'm going to sue you." I said, "Okay, no problem. Sue me." Make a long story short, he said, "Okay, do the surgery." The surgeon did the surgery. Um, I left the hospital on Saturday. I came back on Sunday to go back to work. And waiting for me in the emergency department was her parents. Her parents hugged me and said, "Thank you, Dr. Oxer, for saving my daughter's life." So that's a story on why you should know the quadrants of the ventral body cavity. The quadrants are also divided into regions. Dear God, you don't have to know the regions. I want you to know the 4 quadrants of the abdomen. I will not ask you a question on the regions. I promise you. All right? It gets very complicated. There's no reason to worry about that. Know the 4 quadrants, not the 9 regions. Okay? I kind of told you why it's important. This wrong site surgery is garbage. Don't worry about garbage. Um, we don't do wrong site surgery anymore. We are too good for that today. Okay. The last thing we need to talk about are the other body cavities, the smaller body cavities. Okay. The majority of these smaller body cavities open to the environment. The oral and digestive cavities have 2 openings to the environment. Oral being mouth, digestive being anus. The opening is the mouth on the anterior side, and the posterior side is your digestive cavity, the anus, okay? The nasal cavity, obviously your nose is open to the environment. The orbital cavity, yes, your orbit is open to the environment. You have sinuses. You have sinuses. Okay, and middle ear cavity. The middle ear cavity in your ear is obviously open to the environment. Okay, the one cavity that is never open to the environment of the smaller body cavities is the synovial cavity. The synovial cavity. And these are in joints. I'm going to ask you about the synovial cavity. All right. Every joint has a synovial cavity. Your knee, your elbow, your wrist, they all, and your hip, they all have synovial cavities. And that would be it. So let me get rid of the recording.